Hello, I'm Dr. Robert Graw, founder and CEO of Righttime Medical Care, and this is your Apple Per Day. Today we'll be discussing closed head injury or concussions. Head injuries, or concussion, as it's called in the clinical term, occurs in 10% of all contact sport participants yearly. 63% of these occur in football, but it can occur in wrestling, lacrosse, basketball, and probably more importantly, not recognized, females and males doing gymnastics and cheerleading. It's important to note that participants in other contact sports can sustain the same severity of injury. The sports that we worry about, ice hockey, field hockey, lacrosse, girls and boys basketball, wrestling, and even cheerleading participants. It is now clearly recognized and known that cumulative effects from repeated concussions can lead to chronic brain injury. Over the years, people have always wanted to identify a test which could be used to identify a bruise or damage to the brain which correlates with the signs and symptoms of concussion. A bruise on the brain is easy to identify when it's there and clearly can be followed until improvement, recognizing the time when an athlete probably will be able to participate. However, most concussions are not associated with identifiable changes on X-ray, CAT scans called CTs, or MRIs. Differential clinical symptoms and signs are what we use as clinicians to identify a concussion. What are the signs? What are the symptoms? The symptoms are headache, nausea, balance problems, double vision, photosensitivity, meaning increased sensitivity to light, feeling sluggish, feeling groggy and foggy, change in sleep pattern, cognitive or brain function problems. What are the signs? The signs, they appear dazed, they may lose consciousness, they may have personality or behavior changes. Most importantly, more important than loss of consciousness, is amnesia for the event and for the facts that preceded the injury. When the athlete cannot remember the score, when the athlete cannot remember the play, they cannot remember the city, the day of the week, that's a significant change to their brain. So post-traumatic amnesia carries a more significant impact on longitudinal observation and recovery than loss of consciousness. It's important for any participating athlete or overzealous parent or eager coach to recognize that any head injury can be serious. If any of the signs or symptoms which were previously described occur, the participant should be taken out of the sports event immediately and allowed to fully recover, which can take up to 14 days. Parents should recognize that it's important for them to protect their child's head, since the damage which occurs through repeated concussion can lead to lifelong problems. In an effort to clarify the extent of the damage from a concussion, many research studies have been performed. Most of the significant research has come from the University of Pittsburgh, where they've had an opportunity to study professional football players. These neuropsychological studies, which are performed before and serially in patients after head injury, have identified patterns which can correlate with protective processes which coaches and parents can follow. You should check with your community resources, your coaches, your athletic association, your sports medicine physicians, your psychologists and neuropsychologists to see if they have the capacity to do pre-participation screening to document what the normal neuropsychological functioning for each athlete may be. If headache occurs, if injuries occur, head injury occurs, it's important to do serial follow-ups to ensure that there has been no change in the functionality of the brain, even though there may not be an identifiable damage occurring by CAT scan or MRI. What are the later signs of post-concussion syndrome? General fogginess, decreased processing speed, short-term memory loss, concentration deficit, irritability, depression, academic difficulties. If your child is suffering from these and they've had a head injury, it might be necessary to do some psychological testing to find out if there has been some persistent damage from a closed head injury. One of the most significant and worrisome events that occurs is the second impact syndrome. These are children and participating athletes who have had a concussion and return to athletic activities and sustain a second concussion within 14 days. leading to severe intracranial pressure increases and brain damage. Be cautious. Do not allow a participating athlete to return to full activity until all symptoms of the concussion have been resolved, physician is given clearance, and in the best of all cases, neuropsychological testing done to assure that the functionality, not the observed bruise on the brain, but the functionality of the brain has returned to normal. What is the value of neurocognitive testing? First of all, it establishes a baseline against which future injury can be measured. It also determines that safe period when an athlete could return to full activity. A parent has an obligation, as do coaches, to ensure that no brain injury occurs as a result of sustaining a closed head injury. Be sure to check with your physicians, your coaches, your sports athletic trainers to ensure that they have access to this type of testing to see whether or not it can be a benefit in evaluating that valuable athlete from recurrent head injury, which can lead to chronic lifetime brain damage. Thanks for joining me. This has been your Apple Per Day. Stay healthy.